today we are going to speak about the criminalization of drugs. Hi, my name is Payman and I'm a preventive and social medicine specialist and a professor at Tehran University of Medical Sciences. In this channel, I'm gonna summarize a recently published paper from the Lancet Journals. In previous videos, we had some specific topics including free end-of-life memoirs and the birth of ICUs. I mean the birth of intensive care units. You know that addiction is one of our most important social problems in the world, and our paper for this session is called Drug Decriminalization Grounding Policy in Evidence. The paper was published in the Lancet Journal on November 25th, and its issue number is 10416, and the type of paper is editorial. You know that December 1st is the World AIDS Day, and meanwhile the Global Commission on Drug Policy report was published a couple of weeks ago. This report announces decriminalization of drug use as an essential precursor to ending HIV and viral hepatitis. This commission was created in 2011, and since its formation, based on scientific evidence, the commission has advocated decriminalization as a rights-based approach which can minimize the harms of drug use. Moreover, the UN considered criminalization of drugs to have negative health outcomes. Now, national drug policies are mainly punitive. They are based more on ideologies than evidence. According to the Global State of Harm Reduction 22 report, 115 of 128 reviewed countries still criminalize drug use. Of course, decriminalization alone is not sufficient. In the report, the Commission also emphasizes the need for harm reduction approaches. Portugal country has attracted international attention since about 20 years ago when it approved decriminalization of drugs. Its success was awesome. The number of heroin users fell from 100,000 in 2001 to 25,000 in 2017. Fatal overdoses decreased about 85%. New HIV diagnosis declined about 90%. In addition to decriminalization, the government of Portugal defined addiction as an illness and provided extensive treatment and recovery support for drug users. The government moved addiction people from judicial system to professional care. Indeed, a host of different medical, psychological, and social supports are needed to accompany decriminalization to deal with factors such as homelessness, unstable housing, ill mental health, poverty, racial inequities, and inadequate access to health care. Now, it is clear that punitive approaches are both ineffective and harmful. In fact, decades of criminalization have not only failed to decrease drug use, but also caused the global epidemics of HIV and viral hepatitis. The Johns Hopkins Lancet Commission on Drug Policy and Health found no evidence that imprisonment was an effective barrier against drug use. Incarceration often reduces access to care, causes adverse outcomes following release like homelessness, and facilitates negative exposures during imprisonment because the prisoners don't have access to safe injecting equipments. In contrary to people's beliefs, some strategies including opioid agonist treatments, sterile injecting equipments, safe injection centers do not promote drug use. The Global Opioid Use Report in 2019 showed that only 2 interventions resulted in increases in opioid use: compulsory drug treatment and criminalization of drug use. The authors conclude that decriminalization works, but not in isolation. And although it does not mean removing law enforcement from the complex environment of drug use, it does require health professionals and not the criminal justice system to be the first responders to this public health crisis. Many thanks for your attention. If you are interested, please like it and subscribe to this channel. In this channel, I wanna summarize a recently published paper from the Lancet Journals.